to have you with us on BBC News. The latest headlines this hour. Trump scored a victory. Congress has taken the first step towards scrapping Barack Obama's flagship health plan. And let's stay with that story. We can speak now, I think, to the author, former politician and Trump supporter, Charlotte Laws in Los Angeles. Charlotte, you are a Trump supporter. This is a significant political victory for President Trump. What are you thinking?
Well, I definitely think it is a victory for him. It shows that he is abiding by his campaign promises, that he's being active, that he's getting along with those in his own party. But I think people who are opposing this bill need not be fearful. This is only a first step. The fat lady has not sung, even though Democrats in Congress were singing today. And I think it's very possible that the Senate is going to shoot this bill with a poisonous arrow and then make big amendments, and it will then morph into an entirely different creature. And so even Trump indicated that changes will probably be made. And we will have time for public debates, for town hall meetings, for the Congressional Budget Office's evaluation, and it can all sink in. So I'm very hopeful that it can all be resolved in the end.
It hasn't been independently costed yet, of course, but there are analysts saying it cuts Medicaid by about $839 billion. How do you feel specifically about a bunch of men, and they are predominantly men, removing from the list of pre-existing conditions the effects of domestic violence, sexual assault, C-section, postnatal depression?
Well, I personally am a supporter of universal health care, and there are many Trump supporters out there who support universal health care. So I actually would like to see something put into place that supports, everybody as far as keeping everybody healthy as possible. And I think it's a very difficult thing. I think it's complex. There are many stakeholders with different ideas. Obviously, the rich and the healthy don't want to support the poor and the unhealthy, and yet the poor and the unhealthy can't afford to pay the bills. So I do think it's a complex problem, but I would like to see us moving in that direction. And our health care in the United States is quite a bit higher than it is in many other developed nations. So I think that there's a lot more work to be done on this, but I'm very hopeful that with time we can get it resolved.
It could be a difficult sell, couldn't it? The bill exempts members of Congress and their staff from the effects of the bill. There's that old saying, you should never trust a chef who won't eat their own food.
Well, the Congress in the United States has a very low approval rating, so I don't think this is going to lift that approval rating very much, personally. So I agree with you on that. And I think Trump doesn't understand that so many of his supporters out there do support some kind of coverage for everybody. And I think that he really is ruling from the far right, and I think he needs to understand that he has to be governing for everybody, not just for the Republicans. But apart from that, I do support him. I think that he is certainly putting a lot of energy into being president. He's certainly trying to accommodate everything he said during his campaign, and I have high hopes that he will end up being a great president.
Charlotte Laws, very interesting. Thank you very much.
Thank you.